Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today I'm catching up with a startup that I interviewed way back in 2019, but a lot of things have changed. And so let me reintroduce you guys to HealthSnap and their CEO and co-founder, Samson Magid. Hey, how are you, Samson?
I'm doing well, Jess. Thank you for having me. How are you?
Good. Okay, so I'm checking out the website, and this came off of some news that you guys just recently announced, actually, while we were all at Health, about a partnership with Teva Pharmaceuticals that we'll get into in a little bit. But I took a look at the site, and I'm like, hey, a lot seems to have changed at HealthSnap. So when we first spoke, you guys were working in this data aggregation space as it related to bringing together all this disparate data from sensors and monitors and trying to make sense of it for clinicians. And it sounds like you guys are doing that now, but it sounds like things have evolved quite significantly. So before we jump into the news and what's going on, why don't you just let us know what's going on with your model and how things have changed?
Absolutely. So certainly just to add to that, over the last 2 years, we've partnered with some of the biggest health systems in the country to help them power their home monitoring programs. And so we provide a virtual care management platform that helps healthcare providers remotely monitor and manage patients with one or more chronic conditions in rising risk and high risk populations. So helping them decrease utilization, provide proactive patient care, and diversify their revenue streams as well.
All right. So what really struck me about your model that's different is that you guys focus on providers, like clinicians. Like you guys have some big health system clients. So name drop some of those, and then let's talk a little bit about that model. So who are you guys working with right now?
Sure, absolutely. We've been very fortunate to partner with some of the most progressive and largest health systems in the country. Groups like Mayo Clinic in Jacksonville, Tampa General, Prisma Health System in Greenville, South Carolina, Unity Point Health in Iowa, Montefiore up in New York, amongst others. And all of these health systems are all seeing a very large trend in the demand for monitoring and managing patients that are high risk, high cost in their homes. And they've been partnering with us to help scale these programs directly from their healthcare provider systems and networks to help them manage the rising costs and, of course, decrease utilization for these patients.
Right. Say a little bit more about the manage it from their own healthcare systems, because this is what's fascinating to me, because it's like in this chronic disease management space, it's a crowded space, but typically what we see is a company that has remote patient monitoring that's doing all this stuff in an app. And then it's like how the data gets to the clinician is kind of like a not quite sure. You guys are actually working this from the other direction, it sounds like, where it's like you're really pulling in all this data, but it's a real provider focused approach. I mean, say a little bit more about that, because that was the way I kind of understood it by looking at your site.
Absolutely. So our thesis from day one was that to actually fundamentally transform healthcare delivery in the country, we had to actually partner with the providers and not replace them in the services they're providing. And I think a lot of the incumbents in the space have provided the actual clinical services, where we took a different approach and said, why don't we provide a platform to them and work under their supervision as an extension of their staff? And with these health systems, everything we do is fully white labeled and powered by us. So the HealthSnap brand doesn't exist. It is a Prisma Health System program that we're powering, and their healthcare providers get the same exact benefits of the actual programs as if we were doing it on our own directly. So it's a win-win across the board for their patient care and access, for the healthcare provider systems, and for the actual corporate level at the health system to deliver a remote patient monitoring and remote care program at scale without the resources of building it in-house.
I love that. And there's like two other sexy things I want to point out here. So EHR integration, right?
Yep.
Right? EHR integration. And the other thing that I thought was really cool is we were talking a little bit before we hit record about how this really helps the hospital connect all the way from primary care in through to some of the specialty care that would be involved for like really effective chronic disease management programs. Say a little bit more about that, because you had some really interesting examples there, I thought.
Yeah, absolutely. So again, going back just to like the last 2 or 3 years, COVID was like kind of the spark plug, right? We all talked about it to length. I think everyone kind of got the fatigue of virtual care. And what ended up happening though, was you had a mishmash of solutions at these health systems. When we went into some of our partners, I won't name who, we actually got there and we realized that, oh my God, they have 6, 7 different remote patient monitoring solutions for 6 or 7 different specialties. And so we said, guys, look, there's a better way to do this. we need to centralize all this into one unified platform and one source of data truth that's integrated at scale to your entire EHR. And so we've been able to partner with these systems to provide a condition agnostic platform, really what we call like the operating system for virtual chronic disease management. And it allows them to not only start with primary care, but for patients that have rising risk to be able to coordinate that care across specialties, because all of these different specialties, whether it's primary care, cardiology, nephrology, endocrinology, they're all using the same technology and the same platform so that it does actually work across different specialties. And through our different care plans and modalities, we can now manage different populations with different chronic conditions so that a health system can partner with one company instead of 6 or 7.
The other thing I like that you guys offer is the opportunity for a health system to take the guesswork out of RPM billing, which is, I think, one of the big things that I often hear from health system execs when I'm interviewing them about some of these point solutions is that oftentimes they're dumped on their lap and they're expected to bill for it. And so there's a lot of confusion around that, or sometimes there's just like, well, we're not going to use this because we have no idea how to figure out how to get paid for it. So talk to me about that, because what you guys have developed, I think I'm going to make sure I get the name right. The eligibility report, and you're talking about making sure that health systems can collect some of the RPM money that might be out there for a patient that may go like underclaimed, I guess is a way to say it. So creating a new source of revenue for them to the tune of like over $1,800 a patient per year. So I'm curious about that, and I understand that it's the technology that you've developed around this is also patent pending. So to tell us what this is without revealing too many secrets.
Yeah, absolutely. So if we take a step back, I think a lot of entrepreneurs, they see CPT codes and it kind of becomes this gold rush, right? And if there's a CPT code and then the business will just blow up. But in reality, there's a lot of complexities behind actually billing for the codes through different EHRs and systems. And so we've developed a patented technology that automates all of the requirements by CMS, by Medicare, for remote patient monitoring and chronic care management for every patient for a health system. So at the end of every single month, they don't have to manually track and measure which patients can be billed for what codes. Everything is automated for them. And then through one of our interfaces, we can do what's called an inbound financial interface. And it basically, think about it as like a recurring subscription. So it's a recurring reimbursement stream because these programs are every single month. For these health systems, when they're feeling an economic crush in their margins, they need to diversify their revenue streams. And a lot of companies in the remote monitoring space typically overlook the revenue cycle aspect of the business and focus more on the clinical side or the technology side. But the revenue cycle piece is where you create that ability to scale because there's clear ROI demonstrated. And that's definitely a point of pride for us, where we brought in subject matter experts and leaders at our company that have deep revenue cycle backgrounds in the industry specifically.
That's really awesome. You could hear ears pricking up everywhere among health system executives who are watching this. You could just hear it. All right, let's transition and talk about this Teva pharmaceutical news, because this is another interesting use case. And it actually seemed to me almost to take what you guys have built and really successfully, grown into this like clinician hospital-led chronic disease management space. And you're taking it and putting it into pharma. And it almost sounds like the way you describe being like the operating system for that chronic disease management program in a health system. You're like the operating system for like a DTX somehow. So tell me a little bit about this partnership with Teva and what it really means for HealthSnap and for growing your business.
Yeah, absolutely. So Teva has recently launched, it's called the DigiHaler system. It's a connected inhaler. So think about someone with asthma, they take their inhaler as normal, but it actually has a sensor at the bottom of it to measure peak flow. So it measures inhalation rate as well. So that's a physiological data point that through our partnership, we have a data sharing partnership in place where any patients using the DigiHaler, not only will they get their medication dispensed to help support their asthma condition or COPD, but we're actually getting that data from the actual sensor directly into HealthSnap and then into the EHR for the healthcare providers to see in real time. And from our perspective, this is a really novel partnership and one of the first of its kind, where you're getting a leading global biopharma company with a connected device and medication dispensing mechanism with a virtual care management platform, and then all that integrated directly within major health systems. And so we're really excited about the opportunity to partner with Teva, and it expands our reach into high-risk pulmonary populations. So again, COPD, asthma, these populations typically are not easily managed at home, but after their visits. And so with the partnership, we're able to increase their equity and access to care all the time through the monitoring programs that we have in place.
I love this. I think that this is really interesting. And I think that in this landscape that we're in right now, where especially hospital systems are looking to kind of build out their omni-channel strategies and moving things past just the digital front door. I mean, pulling patients in through the digital threshold and into the digital living room. I mean, this is an interesting one that connects both the patient to the pharma company and then also on through to the health system. So very unique. We'll have to see what happens with this one. You'll have to keep us posted.
Absolutely.
All right. Tell me this though, I have to say, when I first started looking at your business, this whole chronic disease management space, I have covered this extensively for the last couple of years. And I'm curious, and I'm sure you get asked this all the time, but it's like, what's the competitive advantage for a HealthSnap? Well, why wouldn't like a health system, I mean, let's just talk about your core client base. Why wouldn't a health system, look to work with any of the other myriad chronic care offerings that are out there, whether they be those real direct to consumer facing ones like a Livongo or a Vita Health or One Drop. I mean, there's so many of them out there that include some sort of remote patient monitoring capability and then pulling that data. Why go with the HealthSnap? I mean, what's really the competitive advantage, particularly when it comes to that healthcare clinician space?
Yeah, absolutely. So whenever we think about the competitive landscape of the market, you always break it down into who are they actually working with, who are their customers. So it's the 4 Ps, right? The patients, the providers, the pharma or payers. As I mentioned before, we've been very intentional about focusing in on the provider market. So everything that we have built and designed has been centered around the provider and the clinician workflow and not disrupting that, and around the patient experience. And I think that's a very different approach than a lot of the historical companies in our space have been focused on, which is more employer-centered or payer-focused in their solutions. So our ability to demonstrate not only clinical and financial ROI, but have a turnkey solution, everything from patient activation to connected device monitoring, to incorporate lifestyle and behavioral change, like some of those companies that you mentioned, and then tying in, as I mentioned before, the revenue cycle component for healthcare providers and health systems. It provides them with the total package. And I think a lot of companies might have components of that, but when you marry it all together in one platform solution like we've done, it makes it a very scalable solution that is sustainable for these systems for long-term partnerships.
All right, Samson. Well, I want to leave it there, but I have to ask, what's next for you guys? I mean, like you guys, I was surprised to see. I mean, you've raised only just shy of $13 million, which is only, but it's like in this space. I mean, where it sounds like you're kind of in this sexy health IT infrastructure category that's just booming right now. I mean, what's ahead for you guys?
Yeah, absolutely. So there's exciting programs that CMS and Medicare has made available for healthcare providers. You'd mentioned DTX a little bit in digital therapeutics. And so stay on the lookout. We will be making an announcement early next year to incorporate some more therapeutic monitoring programs to our platform. And so our focus is always, how do we incorporate the best-in-class tools to manage patients with chronic conditions in their homes and support multiple conditions as well. So we'll be continuing to expand our offering for health systems and looking forward to what's in store for the company.
I love that. We got to love when CMS has money earmarked for things. That definitely helps.
Absolutely.
All right, Samson. Well, thank you so much for joining us. It's a pleasure to catch up with you. Very exciting what you've built here. It was not at all what I expected when I was digging in, and based on the conversation that I had with your company in 2019. So it's exciting to see how your model has evolved and into something that really does seem like it's filling a big need in the space for those, especially for clinicians. So thanks so much for dropping by.
Absolutely appreciate it, Jess.
All right. For more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It's youtube.com/WTF Health. I'll talk to you guys real soon. Take care. Bye, Samson. Thanks again.
Thank you.